Welcome to Resisting Beta, the men's health podcast. And now, your host, Andrew Bonts. All right, men, we are in for a treat today with Dr. Gregory Scott Brown. And after taking a look at his book and looking at his website and his social media, I had some questions for him that I think we'll get to today that I believe you'll get a lot of benefit out of. And I'm so excited about this conversation because Dr. Brown is so aligned with our mission here at Resisting Beta to cut the male suicide rate in half by 2032 with his book. And I think we're going to get a lot of benefit out of it. He's a fellow believer in advocacy for mental health. He is the board certified psychiatrist, and he writes a column for the Men's Health magazine, which I think is really awesome. I've been reading that since I was like a late teenager, So he believes we can work together to fight the mental health stigma by having an open and honest conversations about mental health. He's an advocate for evidence-based integrative care, which I really appreciated in his book when he talked about the evidence-based, because there's a lot of theory out there, but there isn't a whole lot of data to back it up sometimes. So I appreciated that for sure. And he incorporates, it's not just all like drugs. It's exercise, mindfulness, meditation, nutrition, and a lot of other really healthy balance. He lives down in Houston. So here are a few of the questions that I have for him. How do you build mental resilience and overall wellness?
Yeah.
And what does like amazing mental health look like? Because I think like there's a lot of talk about negative mental health, depression, anxiety, and things. And what does it look like on the opposite side of the spectrum? Because a lot of times we get stuck into what we feel and what we know, and we don't know what's different until we actually feel what it's different. So I'm kind of curious about that. And how can we redefine this shift and really shift the paradigm around how most men view mental health and really how it's different from mental illness?
Yeah.
So first, Dr. Brown, I really appreciate you being here, man.
First of all, Andy, thank you so much for extending this invitation. I love having conversations like this one, and they are just so critically important. And I think that this conversation in many ways answers your question. We're talking about how do men build mental resilience. I think it starts with talking about mental health, right?
Yeah, just becoming aware, right?
Becoming aware of it and realizing that it's not a bad thing. When I travel around the country and give talks to different groups, you'd be surprised. Sometimes I'll ask questions like, is there anyone in this room who, is not anxious or has never struggled with anxiety? And there are a couple of people who are going to raise their hands. And usually it's a guy in the room who's like, I'm not anxious. I don't have to deal with that. Here's the truth. 40 million Americans every year, at least, would meet a clinical criteria for generalized anxiety disorder. You're anxious. Wow. I'm anxious. Everyone's anxious, right? And I think it makes sense for us to just start off by acknowledging that anxiety is not a bad thing. It doesn't mean doom and gloom. Right. We need a certain degree of anxiety to survive. But I think it's important for us to realize that there's certain things that we can do to prevent things like anxiety and low mood from totally upending our life. And that starts with having productive conversations about mental health.
Yeah. I appreciate that for sure. And that perspective. So, what inspired this journey? I listened to your book. I saw you at a couple other podcasts, but I'm kind of curious, why did you decide eventually to become a psychiatrist and pursue that endeavor? Because it's definitely a large investment of your time, and there's a lot of other places you could go in the world of being a doctor.
Yeah.
That's
a good question. That reminds me, several years ago, I was covering an inpatient unit one weekend, and one of the nurse practitioners came up to me and was like, why did you go through so many years of medical school just to become a psychiatrist? Why didn't you go into a field like surgery or, dermatology? We could make a lot more money in the same amount of time. But the thing is, I feel like it's really a calling, right? And I think that, once you start to realize how important it is, how many people um, are struggling, how conversations that we need to be having, we're just not having, and the fact that, there's so many suicides every single day. um, I think someone has to step up to the plate. And I just personally felt that that's what I was being called in my life to do. And I'm so happy I joined this movement.
So you had said in your book that you struggled with mental health. And I think that it's, for me at least, it's something I never get over,
Mm-hmm.
right? It's something that I'm always battling against. I mean, you study this stuff, you've invested a decade or more of your life into this. I mean, is that do you feel that kind of stuff even to this day, even
Man,
with all the tools and resources you have?
I've done so many podcasts. You're asking some really good questions. So I'm happy. I'm happy we're doing this. I mean, the answer is yes. I mean, here's the thing. I want to be careful with how I answer this, right? So just because someone is diagnosed with depression or someone has experienced depression doesn't necessarily mean that, this is a chronic condition like type 1 diabetes or glaucoma that you're just going to have for the rest of your life. You're never going to be able to move beyond that. Um, but in the same time, if you do struggle or you have struggled with depression or anxiety, you do have to be a little bit more aware of, the signs and symptoms of that creeping back into your life. Now, I want to be really clear here about where I am in my own mental health and wellness journey. I've struggled with depression in the past, um, more than once, right? And that doesn't mean that it's not something that I won't struggle with, in the future. Um, Anxiety is something that, I've had to kind of learn, like millions of other people in the United States, around the world. I've had to learn, the role that anxiety has in my life and certain things that I can do when I start to feel that sense of panic, coming along. So just because you're a psychiatrist or just because you've literally written the book about self-care, I mean, doesn't mean that you're immune to any of these human experiences. So these are things that I honestly deal with every single day. And I hope that I was able to convey that humanistic element, in my writing.
Yeah, man, I think that it's really easy to position yourself and kind of get stuck in your own inner narrative that like no one else is like me.
Mm.
I'm not, you can get pretty far down. Like I'm not broken, but I feel broken and I feel alone in my struggle. So I think it's important to hear people like us, to where like we've invested so much time and energy, and obviously the amount of resources you've invested time and energy into your practice and your book is unbelievable. It's still something that is present at times, sometimes more than others, right? So those seasons in life that we struggle with at times, and sometimes sometimes you're in the. I was having a conversation with my friend yesterday. It's like sometimes you're in the suck, and it's just gonna suck, and you have to have tools and resources to balance yourself then,
Yeah.
and pull yourself out, or prevent a further slide down the pit of self-pity, like, so what are some tools and resources that you use in your life that I know you talk about a few in the book, but I'd love to learn a little bit more about some of the things that you found effective.
Just to add a little bit to that, because I think it's a really important point. One of the stories I share in the book is a story of a remarkable guy by the name of Kevin Hines. Some of your listeners may be familiar with Kevin's story. So when Kevin was in his late teens, early 20s, he was living in the San Francisco Bay Area. This guy was a wrestler, physically fit, but he'd been diagnosed with bipolar disorder, and he was suicidal, left a note for his dad, drove out to the Golden Gate Bridge, paced across the bridge for a period of time, and then he jumped, right?
Mm-hmm.
Somehow, somehow Kevin survived that. And since then, I mean, he has gone on. I've gotten to know Kevin. He's a great guy, but he's gone on to become just this passionate suicide prevention activist. Now, something that he shared with me that I thought was just incredible that I didn't know is that 20-ish years later, every once in a while, he'll still have a suicidal thought, right? So just because, he had this significant attempt and, he's a suicide prevention activist doesn't mean that that automatically goes away. Now, at this point in his life, he's learned so many tools that he didn't necessarily have 20 years ago that could include medication, meeting with a psychiatrist, meeting with a therapist, self-care strategies, something that he shared with me that, I share with my patients that will kind of answer the second part of your question is the ability to buy yourself time in those critical moments, right? So whether that means you're having a really difficult conversation with your spouse or, your boss says something that rubs you the wrong way, or you're experiencing a suicidal thought, being able to realize that oftentimes those intense emotions will come in waves and they pass, right? And the thing is, if you act or you react, especially when it comes to suicide in the moment, that's not something that you can take back, right?
Right.
So the thing is, sometimes, just being able to sit and, take some deep breaths for 5 minutes, 10 minutes, half an hour, you know, to go for a walk, to engage in a meditation session, to connect with a buddy. Those are things that can, in many ways, extend the fuse. Buy yourself some time so you can let that intense wave of emotion pass. And then if you need to reach out to a professional like me, I mean, we're always here to help.
Yeah, I remember hearing Kevin on the Ed Milet podcast just a couple weeks ago, I think, and his story is so crazy on what had to happen for him to be here to continue to share his message of advocacy. I mean, to the point, like even a sea lion, like
Right.
kept him afloat until
Right.
until the paramedics arrived.
Right.
Like just an unbelievable act of nature or fate or the universe, or if you're spiritual, God or someone was protecting him,
Right.
to allow his story to be out there and impact man. And one thing that I really appreciated about his message is he had one big ask is he had stopped saying they committed suicide, and because it's not a commitment,
Died by suicide. That's
died by suicide, right?
Yeah.
Like,
so the American Foundation of Suicide Prevention, and Dr. Christine Moutier, their leader, who I've gotten to know quite well, has really spearheaded appropriately this mission to eradicate that language, quote unquote, commit suicide. Because we have to realize it's not something that people do to themselves, right? I mean, mental illness is a disease, right? And, I mean, when people succumb to suicide, they die at the hands of that disease. And it's important for us to acknowledge that.
yeah, I think that it's important to talk about this stuff because I think that it's easy to feel alone in your thoughts, and it's easy to feel like, like for myself on this weekend, I had one of the worst days I've had in a really long time. And it was just rough. And I had the words come out of my mouth, and my kids were in the room, that I was like, I quit. I just quit. And it wasn't filtered. It was just the words. But then my 8-year-old, she's like, Dad, do you not want to be here anymore? And all that stuff. And I'm embarrassed or ashamed that I had those words come out of my mouth in front of my children. And my 10-year-old kind of diffused the situation. Oh, Dad's just kidding and that kind of stuff. But at the time, it was just, I wasn't really, but it was just, for me, I had let some of my daily rituals slide. Like my meditation, I do some cold therapy stuff, journaling and gratitude, all those things that like I know helped me. I just got busy and stopped doing them, and it kind of slid too far. And then there's some other stresses and pressures in my life that are happening, but like it comes at me like in waves. It's crazy. So
Yeah,
I've been there.
and
It's rough.
I'll tell you, it's a common. And thanks for sharing that, because experiences like those are common. I mean, I have those experiences too. I mean, again, I've written this book about self-care, and I know the techniques, I know the skills, but sometimes I have to be really, really intentional about doing them. I mean, there's some days that I feel so anxious and, I'm getting heart palpitations, and I'm just like, I'm just a nervous mess. And the only thing I want to do is just close myself in a room and just not deal with anyone. Right. But the thing is, I mean, the thing is, if we're intentional about what we're feeling, what we're experiencing, then we can say, okay, this is my body and my mind telling me, okay, it's really time for me to tap into these skills that I know. Because it's probably the last thing that we're intuitively going to want to do when we're experiencing it.
Yeah, I think that the permission to feel and our ability to expand our capacity to communicate what we're feeling, to ourselves or to other people, and like practicing that muscle. And that was one thing you mentioned in your book. It's where we can, you can lift weights and work out, and all that stuff is really good stuff. And we focus on building muscle and building cardio and our ability to improve there. But most men, or most people really, don't have a practice of building their mental health muscle and resiliency. So I'd really like to hear you talk more about more like the positive upswing of this side of the coin, right? The mental health. Like, what is great mental health look like, and what is that life like? When we have those moments when we're there.
So in the resiliency chapter of the book, I shared the story of Marcus Smith, who was a former NFL linebacker. A lot of really strong guys. Their stories are in this book, The Self-Healing Mind. So, he had been depressed, anxious, didn't even talk to his wife about it. Again, was playing in the NFL, didn't feel comfortable sharing that with his teammates or his coaches. And he was on the brink of suicide, almost drove his car off a cliff. Before his mother-in-law somehow, by the grace of God, kept calling him until he eventually picked up the phone. And, he credits that as one of the things that saved his life. And so you have to think about this idea of grit and resiliency are two different things, right? When you think about grit, you think about, okay, I'm just going to suck it up. I'm going to push through. I'm not going to share anything with anyone. I'm going to be a strong, powerful man, physically and mentally, right? And sometimes society will tell us that's what we need to do. Resiliency is more about the ability to adapt, to adjust, to learn, to unlearn, to be vulnerable, right? And to really embrace that mental health is, I define it, this idea of living with four things: purpose, balance, contentment, and hope, right? So if you hold on to those four things, I mean, I think it allows us the ability to be anxious sometimes. It allows us the ability to feel sad sometimes, It allows us the ability to be in a bad mood, right? Or not have the best day. But as long as we still have that purpose, we're trying to reconnect with finding balance, work-life balance, balance with physical and mental health, not pushing ourselves too hard, contentment, right, in our lives, and always, making sure that hope is this actionable thing, that we're moving closer to it, not just that we're wishing for it, but we're living with it. I think that's what it means to live with mental health, and that's what I strive to do in my own life.
So contentment, I'd like to unpack that a little bit, because you can take contentment and almost have it be like you can look at it from like the being passive or just going with the flow, versus, and those are, depending on the context, they may not be the most positive components where it's like, is contentment, but what do you mean by contentment in having that be part of those four things?
I think a lot of men, when they hear contentment, it sounds like a dirty word to them. It's like, I don't want to be content. They like extremes. They want to be happy. They want to be excited. They want to push, right? Contentment is really, when you think about it, you'll have these emotional extremes like happiness. The day that you propose to your wife and she says yes, that is, you are happy, right? The day you get that promotion at work, or you get, I don't know, 100,000 followers on Instagram. Those are emotional extremes, right? And so many of us, it's like, if we don't have that, particularly guys, if we don't have that, I'm not going to say every day, but if we don't have that enough, it's like we feel like we don't have anything, right? Contentment is more about taking a step back, right? And realizing, hey, over the past 3 months or so, I had 5 or 6 or 10 of these happy moments in my life. Maybe I had 3 of these low moments in my life. That's a net sum of 7. Overall, this is contentment. I don't have to have that all the time. I don't always have to be chasing that. And I think that allows us to really cherish those moments, those happy moments, those emotional extremes, positive emotional extremes when they do occur.
And I think that's where it's important to live in gratitude. And I really, something you just said really spoke to me, at least internally as an entrepreneur, been being an entrepreneur most of my life, to where I spend so much time climbing the mountain. Like you're chasing, you're building stuff, to where when I was 50 pounds overweight, I was like, oh, life will be better when I'm fit. And then now I'm fitter than I have been in my life. And it's like, it's like, okay, well, it's nice, but like, it's not exactly what I thought it was going to be, and there's been so many moments like that. And I've had conversations with other men who have pursued success and rose to high lengths in their career, and they get there and it's like, this isn't what I thought. So I think it's really important to talk about this sort of thing, to where a lot of the men listening are leaders in their companies and leaders in for their own companies or other people's companies. And it's I think a lot of times as an entrepreneur, you're like, okay, well, if I just make it big, life will be great. Or when my kids are this age, I'll be happy.
Right.
Or when I'm 220 pounds, all my problems will go away. And as I get older, it changes.
Right. And we see people who are highly successful, Andy, still struggle with depression, still die by suicide. We have to acknowledge that. So my dad, who is 81, shared something really beautiful with me, that really helped me, I think about contentment in a different way. He said, I've never acquired great wealth, but I have a roof over my head. I have a loving wife. We've been married for 40 years. I'm proud of you, son. What more could I ask for? And he's had successes in his life. He's had extreme highs, extreme lows. So I'm not, my calling for guys is not for them to give up their ambition.
Right.
I'm ambitious. You're ambitious. A lot of us are ambitious. There's nothing wrong with being ambitious and successful. But I think we have to put that ambition into perspective in order to truly appreciate, the highs when they are to happen, and to appreciate, life in between those highs.
Yeah. A few years ago, I stumbled upon the concept of stoicism and practicing stoicism. And I really like their lens on success. And as I tell stories about Marcus Aurelius and some of the other really successful people from way back when. They had said they're just basically allowing themselves, like, I have nice things, but I'm not going to let it define me, because they could be taken from me at any point in time. It's just being able to appreciate them for what they are, and for successes for what they are, for your health for what it is, but just not letting it, define you, and then just being okay with the today's moment right now, because death is coming for us, our own mortality. We will die someday. It could be today. It could be 50 years from now, but it's coming, So
Yeah. And the ability also, just add to that, not to be too attached or to hoard, things in our life that are fleeting, right? I mean, I think that, life is a gift, and the things that we have in our life, including our career and, all of the other worldly successes, are kind of being lent to us because it's not permanent, right? And so if we think of it that way, again, I think it just brings us closer to really living with mental health.
So one thing I really struggle with is that comparison mindset, where you feel like, it's advice I would give to a 20-year-old, like, run your own race, don't chase other people. If other people are having kids and get married and you're not, don't feel like, but it's still something I struggle with today, with myself going through a divorce and kind of like losing the white picket fence fairy tale, like movie script of a life, or whatever. And just being okay with it most of the time. But then, I compare myself to other people in my family and other people around me, and you're like, oh man, I feel like I'm behind. And I'm wondering if you have any advice for men who might share that struggle with me on that comparison mindset and maybe feel like you're behind in life.
Yeah. So a couple of years ago, I did a podcast with Shaka Smart, who was coaching the men's basketball team at the University of Texas at the time. I went up to his office, and one of the first things he said to me during that episode was he quoted Roosevelt: "Comparison is the thief of joy," right? And again, it sounds cliche, but I mean, it really is. I mean, this is something, I'll be honest with you, I struggle with this a lot as a psychiatrist, right? It's kind of like, people look at psychiatrists and they just assume that psychiatrists or mental health pros or anyone talking about mental health has a perfect life, right? And they don't have problems, they've figured everything out. They get up at 4 a.m. and they meditate for 2 hours and they sip on matcha tea, right? And they never get upset. I mean, we're all human. I mean, and I think that, the fact that, some people struggle with anxiety, some people go through divorces, some people, that's part of what makes us human, right? And I think if we're really comparing ourselves to other people and seeing the truth rather than what we're choosing to see, then that comparison will actually tell us and show us that, hey, that brother I'm comparing myself to, if I really got inside of his house and saw what was going on, I'd realize it's probably not that different than the things that are going on in my life, right? That's one thing I think, working as a psychiatrist and hearing so many stories from people that on the surface you'd never imagine, were struggling with depression or anxiety or problems with their relationship or problems with their kids. It's like, hey, patient A and patient B and patient C and, friend A, B, and C. It's like, this is a human experience. I mean, people are struggling with the same things and they're just doing their best.
I think there's a lot of men out there that kind of get stuck in the between like and okay most days. So I'd love you to cast a vision of like what above okay to great mental health feels like when you put these things into practice. You've applied them, you've applied that knowledge, and life is flowing, like paint a picture around that. So, I mean, we just talked about not striving towards something, but just,
But I think it's
to give that perspective.
I think it's a mindset. I mean, it lives in the mind, right? And so, and it's a mindset that you alluded to earlier. It starts with gratitude. I mean, if you're alive, you have a purpose, right? You know, and realizing that again, once we get into this comparison mindset, a lot of times it can shift us away from focusing on the things that we do have in our life that bring us joy, or things that that we're grateful for. And so, I mean, there even been some studies. I was at a conference a few weeks ago, and there was a cardiologist giving a presentation saying that, and I haven't read this particular study, but she suggested that there are studies showing that something like keeping gratitude journal every day has actually been shown to reduce heart rate variability, right? So can improve these physiologic signs of stress, right? But Andy, we got to be intentional about it, man, because just saying it, I mean, a lot of guys will hear this stuff and they're like, Andy and Greg are sitting here, they're talking about a bunch of common sense stuff, but they're not doing it, right?
Right.
So we got to do it.
Yeah, it's the difference between knowledge and wisdom, right? To where the people that have wisdom have applied their knowledge to something and tested it and practiced it. And it's just that the one word that over the last few years I constantly remind myself of is practice, because I was an athlete and I practiced a lot in high school and college. And then as you get older, you don't necessarily practice stuff as much. So having that practice mentality for mental health of like, okay, I'm not great at this right now, and I'm not going to get better overnight, and I'm impatient, and there's no miracle pill for this, because if you just start, I guess there might be some miracle pills if you're a pharmaceutical company, And
I misspoke a second ago. So gratitude journal increases HRV. It doesn't decrease it. So you want a higher HRV.
Oh, okay.
Yeah.
Cool. So we have about 20 minutes left. I like to talk about tools and tactics, and I think that we'll go here for a bit. So I'm going to start this a little bit earlier than I typically do in the episodes, of asking you to put on your professorial hat and give the men some homework to give them some quick wins in their life. Because I think that it's easy to listen to something like this and hear the theories of like, but if you're down in the depths today and you're having a rough one, or maybe you've been there for a while, you've let it skid, how can we give these men some quick win, something to focus on over the next 7 days where they can feel some progress and momentum towards moving themselves out of that state?
Gratitude. That's number one. Okay. So I will challenge anyone listening to this today, right? Whenever you have time today, at the end of the day, whatever, physically write down 3 things in your life that you're grateful for. And for the rest of the day or night or whatever, just focus on those things, right? Keep those things in your mind. If you need to say them out loud, do it, right? You'll realize that you probably have more going well for you in your life than you think. If that's an exercise that you need to repeat once a week, do it the whole week, just focusing on what are these 3 things that I am grateful for. The second thing that I really challenge people to do is to develop a meditation practice. And that doesn't have to mean, you're going to go join some fancy meditation, bar or whatever, just be it. And meditation, I think a lot of guys can be intimidated by it. I mean, 10 minutes, set a timer, find a dark room, or don't set a timer. I mean, you can sit down, you can lie on your back, put one hand on your chest, the other on your belly, bring your awareness to your breath, close your eyes, and just breathe, right? When you experience, I mean, the first time I tried this, I lasted maybe a minute because the thoughts were just, I mean, it's like I didn't like sitting there. I need to get up and move, right? But I mean, if you experience an anxious thought, just imagine it like it's on a cloud. Maybe your sky, your imaginary sky is just filled with clouds at first time. But the thing is, those clouds will float on by. And the more you do it, the easier it gets. And then the third thing that I would recommend here that anyone can do is to move mindfully. I hesitate about saying moving your body, although that's great for mental health too. But I think moving mindfully is something that I've even started to do within the past, 6 months or so. I'm a runner. I like to put my headphones in and go for a run, but taking walks, right? And listening to the sounds of nature when I'm taking a walk, right? Or moving more slowly and just being cognizant of my own thoughts is something that helps tremendously, I think, with allowing us to be more mindful and allowing us to be more grounded and find that balance. So gratitude, meditation, and moving your body mindfully. That's my challenge to men.
Yeah, I think that they're all simple, but they're not easy to do repetitively, and especially some the meditation stuff. I remember if I put myself in my shoes 10 years ago, you start learning about meditation, you think about like some Buddhist monk sitting there on a cushion, just like saying Om like this. And as a guy that grew up in northern Wisconsin, it's like, okay, well, that sounds pretty woo-woo.
It does. It does. But here's the thing, and here's the thing that as a medical doctor, I find fascinating. So in the book, I go through different ways of manipulating our breath, right? 4-7-8 breathing. You can read the book and learn all about this. Alternate nostril breathing, Ujjayi pranayama. And the thing is, I mean, when we manipulate our breath in certain ways, we have the potential of increasing an inhibitory neurotransmitter called GABA, right? GABA can help produce this sense of calm and relaxation. If you were to hook up an EEG to a person's scalp and track their brain waves, manipulating our breath in certain ways can actually increase the amount of alpha wave activity in the brain, right? Meditation can, actually activate something called the default, reduce activity in something called the default mode network, which is, this series of parts in the brain that's overly active in people who are anxious and stressed out and overworked. So there's tons and tons and tons of science behind this, right? And so, I think the most difficult step, I think, for men to overcome here, if they're thinking about like, this is woo-woo stuff, I don't know if I could do this, is to realize that it's medicine, right? And I think the best way to actually determine whether or not it's going to work for you is to try it.
Yeah, I think it's one of the big differences I've seen with men and women that on this topic is women tend to be a little bit more in tune with their own body chemistry, right? But for men, as I've gone through this journey, learning like what you do and how it influences your brain and overall life, how fulfilled you are in life, like what you eat and, the amount of sunlight you get and exercise and all of that body chemistry stuff, that if you have a imbalance of it to where, I don't know all the medical terms of why it, but like just like stuff like understanding serotonin and what causes it and how to just be aware of what you put in your body and on your body, and what you do impacts your overall quality of life. And I feel it more now that I'm 40 than I did, when I was 25.
I'm turning 40 in a few months, so I'll have to get some advice from you about what it's like to be the big 40.
Yeah, it's a lot like 39, man. Just another another day of living, I guess.
But yeah, I mean,
Yeah.
you're absolutely right. Right. I mean, I think that the thing we have to all of these things are interconnected. One thing I find really fascinating about mental health is we talk about these chemicals, neurotransmitters like serotonin and dopamine and norepinephrine that are so important for mental health. They're already there in our brain. Like if I were to give someone a pill, it's not like I'm giving them a serotonin pill. It's
Hmm.
just you're manipulating how the brain is using the serotonin that's already there. Right.
Right.
Things like falling in love, eating that big juicy steak that you've been craving, seeing your daughter, after she's been away at camp for a week, that feeling you get dopamine is being released, in the brain, which helps us feel that warm and cushy, fuzzy feeling that we feel in those moments of happiness, right? So, we can get those things from these everyday experiences in our life. Now, when people are struggling with severe depression, a lot of times those mechanisms don't work as well. So things that
Mm,
should bring joy to our lives just don't the way they
right.
should, and that's where medications at times, along with some of the self care strategies that we've talked about today, can really help.
I love that. I think that it's important. One of the things where I screwed up is I read a book called The Miracle Morning by Hal Elrod, and he has the Savers method, which is I think 6 or 7 steps to do on a daily basis for like a daily success ritual. And sometimes I'd do them all, and other times I would fail
Hmm.
and do one or two. Then I would beat myself up over it.
Hmm.
So I think that it's important to point out to where yes, we have all these different tools, but just if you're struggling and haven't been able to create a repetitive thing in your life that includes one or all of these, just pick one. Pick one you're most comfortable with, and then develop a habit around it, and then maybe add one more next month. Give yourself the grace to just try one thing and see its change in life. Because I mean, you talk about the scientific method in your book a little bit, where it's like, if all of a sudden you change all these variables in your life, you don't necessarily know what worked and what didn't.
Hmm.
So it's hard to repeat that process.
Right.
So,
Right.
so just change one thing. Pick one that we've talked about today and apply it. And try it. Test it for a month. Date it for a month. Practice it for a month, and see what happens when you do it every single day.
Hmm.
And it'll only take you maybe a couple minutes. Especially for gratitude or meditation. It's like,
Right.
okay, well, my goal this morning is to meditate. Put on some meditation on YouTube. There's hundreds of them, thousands of them, and just sit with it for 3 minutes and see how it goes. Or find an app. Or I use an app called Othership,
Hmm.
and man, I go through that, and I feel like I just had like 4 tequilas after I'm done, and I have that my body's flying high, and I'm like, whoa! I didn't even realize just breathing can give me the high that I feel at the top level of alcohol before you start to, you know, get sad and that kind of stuff sometimes, depending on what your mood is. So
Yeah. So here's the thing: when you have a shot of tequila, it's activating the. I'm getting a little nerdy here, but I think the audience, the listeners will appreciate this. So when you have a shot of tequila, the alcohol is really binding to the GABA A receptor in the brain.
hmm
Remember we talked about GABA earlier, that taking a
hmm
deep breath, right? And so again, other things are going on, dopamine, GABA, but with alcohol. But again, when you talk about that buzz, it is totally possible to get that same type of buzz, from meditation, especially if it's meditation that involves a sense of breath work. Now,
mm.
people who are doing it, and again, when I'm engaging in a breathwork activity, one of my patients, I ask them specifically, okay, so how does your body feel right now when we finish, and how does your mind feel, so they can acknowledge the effect that the activity actually had. Because a lot of times we'll do it, we'll feel great, but we're not making that connection that, hey, this is why I felt that way. So if we're able to do that, I think you get to the point where you actually crave those experiences and you want more of them.
Yeah, and you're not going to know it until you try it.
Hmm.
So, and if you think it can't happen to you, you're wrong.
Hmm.
Just try it out.
Right.
So we're coming to our last couple minutes of the podcast, and there's a question I've been asking each of the guests, and I'm curious on your answer to this. What does it mean to be a man?
I think being a man, I'd say the most important thing, and this is going to sound cliche, but I think it's so important, is allowing ourselves the ability to be vulnerable, right? And I say that because, I think it's something that allows us to check all of the other boxes that we consider when we think about what it means to be a man. You can't really provide for yourself or your family if you're not able to be vulnerable. You can't establish good friendships or, be a good dad if you're not able to be vulnerable, right? It makes it very difficult to have healthy, intimate relationships with, your spouse if you're not able to be vulnerable. Now, being vulnerable doesn't have to mean wearing your emotions on your sleeve. I think that's what some people may think of when they hear that, right? It's like, oh, I just got to talk all the time about everything with anyone who crosses my path. That's not what I'm saying here. What I'm saying is we don't have to be so closed, right?
Right.
And if we're having a hard time, if we're struggling, if we're feeling something, and there are people around us who care about us, who love us, who, want to see our best interests played out, rooting for us. I mean, being open enough to share, I think is important.
Yeah. I think it's just like building that emotional resiliency to be able to identify and share what emotions are feeling, but also having the practice of like, okay, well, not everybody is ready to hear or willing to hear, and the timing isn't always right, like
I totally
talk to the grocery clerk.
Right. And again, we have to be careful about how we're, conveying this here. So what I'm saying is, I'm sure people listening to this can identify one or two or three or more people in their life who are like, they are sitting with me. They are wanting me to talk to them. Like they are curious. I mean, I'm getting a text from someone asking me how I'm doing, and I'm just saying I'm fine. Right.
Right.
So those are the people that are kind of like saying, hey, I'm here for you. And the thing is, that sometimes we miss the mark. That first conversation might be with someone who was like, okay, we actually thought that they were curious about how I'm doing, but they really weren't, right? And that's going to happen, right? But all you need is one person really in your life to be able to get that, conversation going with. And I think that makes it easier to be vulnerable around other people in the future.
For sure. I mean, this conversation is super relevant, and I got a lot out of it. And I feel like we could go for a lot longer, but that's not how it's going to be.
Yeah.
So one thing, men, is go get Dr. Gregory Scott Brown's book. It's on Kindle, on Audible. I downloaded the Kindle version. So just take a look at it. And I mean, he tells a lot of stories. He brings in the stories, like he had referenced a few in the podcast here. He talks about Kevin Durant and a lot of other different people you would understand and maybe can relate to, just them as human beings, not as, professional athletes who are on a pedestal somewhere, So I'll attach his where to follow him on social media and his website to the show notes. You can check yourself out there. But before we send him off, do you have any last golden nuggets that you'd like to share with the audience?
Yes. So I think the most important thing is some people will look at the title of the book or the title of this podcast or the content of this podcast, and they'll think, oh, this is only for people who are depressed and anxious, right? And it's not. I mean, mental health is for anyone with a brain. It means all of us, right? And so I think it's important for us all to realize that, conversations like this one, the book, The Self-Healing Mind, any content about mental health, good credible content, can really resonate with all of us if we open ourselves up to allow that to happen. And it could change our life in a positive way.
Yeah, or you can change the life of somebody else that you can ask the hard questions.
That's right.
And dig past, like, how are you doing? I'm fine, or I'm good. Just ask that second question, because you never know. You never know what people are planning to do that day.
That's right.
I mean, that was one thing from Ed Milet's podcast, that he was just on that bus going to the Golden Gate Bridge and just waiting for somebody to say, "Are you okay?"
Right.
And no one did.
No one did.
No one did. Everyone just watched it happen.
Yeah.
And you never know.
Right.
So, man, I really appreciate you being here and investing the time today for mental health advocacy. And I honor you for everything you're doing in the world of mental health. So I really appreciate it.
Thank you so much, Andy, for having me.
Thank you for listening to this episode of the Resisting Beta podcast. Here's where I need your help. I'd love for you to give us a review on your favorite podcast player. Also, follow us on TikTok and Instagram and share this message out to a man that needs to hear it, because that's how we impact this world. Thank you very much. Make it a great day, men.